The common cold is, well, common. We all get it. We want to prevent ourselves from getting it and others. We want to minimize spread, reduce our symptoms, shorten the duration. So therefore, it's no surprise that myths about the common cold are just as common as the cold itself. Now, the common cold has been with us, obviously, for a very long time. It was known to many of the ancient civilizations, according to historical records. In fact, the Egyptians even had a hieroglyph for it. But of course, none of those ancient civilizations knew what caused the common cold. The term common cold itself dates back to about the 16th century. In the 18th century, Benjamin Franklin, after years of study, wrote, "People often catch cold from one another when shut up together in small, close rooms, coaches, etc., and when sitting near and conversing so as to breathe in each other's transpiration." So Ben got it just about right. But he wasn't the first one to recognize that colds and other diseases were spread by germs. In fact, the first notion of a contagion was first proposed in 1546 by Girolamo Fracastoro, who wrote that epidemics were probably caused by seed-like entities that spread from one person to another. And then, in 1835, Agostino Bassi proposed the first clear germ hypothesis. He proposed that tiny living creatures caused this silkworm epidemic that was occurring at the time. And this turned out to be true. The silkworm epidemic was caused, in fact, by a fungus. The germ theory of disease didn't really gain acceptance, though, more widespread until about the second half of the 19th century. And of course, it was thought that germs of one type or another must be causing the cold. The cold is an infection. It spreads from person to person, as was known about for centuries. Although scientists first thought that the cold was caused by a bacteria. And in fact, there were efforts to develop a vaccine against the common cold based upon this notion that it was a bacteria. But that turned out not to be the case. In 1914, a biologist by the name of Walter Kruse, a professor in Leipzig, Germany, showed that viruses caused the common cold, not bacteria. However, his conclusions were not widely accepted until the mid-1920s, almost a decade later, and not until they were replicated by other scientists. So what is the common cold, medically speaking? What is it specifically? Well, we would refer to the common cold as a viral upper respiratory infection, an infection of the nasal passageways, the oral passageways, and the pharynx. We use other terms to refer to infections in other parts of the respiratory system. For example, pneumonia refers to an infection of the lungs themselves. Sinusitis is an infection of the sinuses. These are air-filled cavities in our skull, in the front, in such as the maxillary sinuses in our cheeks. We also have sinuses in the front of our skull, above the eyes, for example. And these are connected to the nasal passageways. You can get both acute, short-term, and chronic, long-term sinus infections. And we also use the term bronchitis to refer to inflammation or infection of the airways that connect to the lungs, the bronchioles. Now, of course, these are not mutually exclusive. You can get an upper respiratory infection that then leads to a sinusitis or may lead to a bronchitis. If you ever had a really bad cough after a cold that seemed to be constricting your airways and making it difficult to breathe, you probably had a secondary bronchitis following a cold. Now, there are hundreds of separate viruses which cause the common cold. The most common type of virus is the rhinovirus, responsible for about 30 to 50% of colds. Coronaviruses are responsible for 10 to 15%, influenza viruses for 5 to 15%, and then the rest caused by an assortment of other viruses, including human parainfluenza, human respiratory syncytial virus, adenoviruses, enteroviruses, and metapneumoviruses. The reason why you can get the cold multiple times, why you aren't immune for life once you've caught the cold once, is that each time you get the cold, you're being infected with a new type of virus. It may be a different species, even a different genus of virus, or it may just be a different strain of a virus that you've encountered previously. Now, it is generally recognized that the cold is more common in the winter. Maybe that has something to do with the origins of the name of the common cold. This is partly due, if not mostly due, to the fact that in the winter months, kids are back at school. People are also generally spending more time indoors, in close quarters, as Benjamin Franklin noted. Now, parents will recognize the fact that when their kids start coming back from either daycare or school, they often bring home viral infections, and that tends to spread throughout the family, who then may bring it to work. And in essence, kids getting together with maybe less than ideal hygiene, spreading viruses around, become a perfect breeding ground for these cold viruses, and then that spreads to the rest of the population through multiple pathways. So that in and of itself is probably enough to explain why colds are so much more common in the winter months. There is some evidence, however, that certain cold viruses may be actually adapted to the cold weather. They surround themselves in a protein coat that is more resistant to cold. So they may have actually adapted to that. But we can get colds in the summer. There are summer viruses that we're more likely to get in the warmer months. So if you come down with a cold in July in the northern hemisphere in the middle of the summer, that's more likely to be an enterovirus, whereas if you get a cold in the winter, it's more likely to be a rhinovirus. How does the cold spread? Well, colds spread largely through direct contact. Somebody who is infected and has the virus on their skin, passing it on to someone else, who then gets infected with it themselves. This often occurs from touching either your mouth, your nose, or even just your eyes. Rubbing the eyes, in fact, is a very common source of infection. However, it is a myth that you can only get the cold through direct contact. In fact, you can get exposed to the virus and get infected through indirect contact. That means touching something that someone else who was infected touched. The technical term for that is a fomite. A fomite is anything on which a bacteria or virus can survive long enough to be spread indirectly from one person to the next. You can also, of course, get exposed to the virus in water droplets in the air, which can be expelled by coughing or sneezing. So you may catch a cold simply by being exposed to the virus from someone who sneezed maybe even across the room from where you are. And that is, of course, why there is always the strong recommendation to sneeze or cough either into a tissue or handkerchief or into your elbow if nothing else is available to prevent that spread. There are many myths, as I said, surrounding the cold. Probably the biggest one, however, is that cold weather causes the cold itself. How many times have you told someone not to go out or to be careful and bundle up before going out in the cold or in the rain, otherwise you may catch a cold? However, the weather itself does not cause a cold. You can't get the cold from being exposed to cold weather or being wet or being out in the rain. You need to get exposed to a cold virus in order to catch the cold. However, there's a separate question of whether or not being cold or being wet and damp makes you more susceptible to catching the virus if you are exposed to it. Largely speaking, the evidence for that is negative. Even being cold doesn't even increase your susceptibility. But it's still, I would say, slightly controversial. That question has not been put fully to bed yet. What about vitamin C? Now, you may have heard for years, this has been a very, very common belief that taking vitamin C can either treat or prevent the common cold. This was popularized by Linus Pauling and others, and then has become so widespread in the culture that most people I speak to take it for granted that vitamin C can prevent or can reduce the symptoms of a cold. But it's been researched for decades now, and we've broken it down into every sub-question that there is. Does it prevent you from catching the cold itself? The answer there is very clearly no. The research shows that by taking regular doses of vitamin C, it does not prevent you from catching the cold. Reviews of dozens of studies with thousands of individual patients show no benefit. What about decreasing the severity of the cold once you catch it? Are the symptoms less severe because your body is better able to fight off the infection? And there the answer is no as well. There's no decrease in the severity of the symptoms of a cold. What about reducing the duration of the cold? Might you fight it off a little bit quicker if you take vitamin C? Here, the evidence is not as conclusively negative. It still is trending negative, but there is some weak evidence for a slight decrease in the duration of a cold by an order of magnitude of about a half a day, not much more than that. If you take vitamin C at the very, very beginning of the cold, or were already taking it before you got the cold. So there is a slight, if any, benefit and only a slight advantage to the duration of a cold, which is still controversial, from vitamin C, but no benefit to either to either the severity of the cold or to the chances of catching it in the first place. Herbal remedies have become popular for the common cold. A few years ago, echinacea was the most common herbal remedy, and it was marketed for treatment of the common cold to prevent infection, to reduce severity and duration. Now, I'm going to talk about echinacea in more detail in my lecture on herbalism, but I will say at this point in time that after extensive research, clinical research, in people with echinacea, the evidence clearly shows no benefit for either prevention or reduction of severity from taking echinacea. What about other types of supplements, not herbal remedies, but just vitamins and minerals, nutrients to help boost your immune system and make you better able to fend off or fight off the cold or other viruses? One product in particular called Airborne, which is marketed as being developed by a school teacher, is really basically just a multivitamin. The notion of Airborne is that you take it when you're going to be on a plane, you're going to be in close quarters, exposed to a lot of people who may be spreading around viruses, and it will prevent you from catching the cold if you're about to take that airplane trip. Well, it turns out that there's really no theoretical basis for the notion that taking a short-term supplement will improve or increase your immune activity and make it more robust or better able to fight off a cold. And in fact, there is no evidence to show that taking Airborne or any other multivitamin or supplements reduces either the risk of developing a cold or its severity or duration. It's also interesting to point out that specifically Airborne has very high levels of vitamin A, and if you take it as recommended, you actually will get what is considered to be an overdose of vitamin A. One interesting intervention that has become recently popular is called neti pots. Now, this is essentially a little pot. It kind of looks like a teapot, but it has an elongated spout that you fill with warm water or salt water and then irrigate out your sinuses. You pour the liquid into your nasal passageway. It then goes into the nasal sinuses and out the other side, and it is meant to flush out the mucus, flush out any bacteria or any viruses. So again, we need to break down to very specific claims. Does it prevent infections when used on a regular basis? And is it helpful when you get a cold or sinusitis? Well, regular use actually may increase your risk of sinus infections by cleaning out too much of the mucus, which is there for a purpose, is there as part of the immune system. And also you may be reducing the normal bacteria which inhabit the mucous membranes and are there to prevent infection from other bacteria or from viruses. So routine irrigation of the sinuses is not a good idea. It's not helpful, as many people claim, and in fact might increase the risk of sinus infections. However, a short-term use of a neti pot or any method of nasal passageway irrigation, it doesn't have to be through specifically a neti pot, but sinus irrigation has been shown to decrease the duration of a sinus infection. And there the concept actually makes sense. If you have bacteria, especially clogging up your sinuses, the most important thing to relieving that infection is just flushing it out, is clearing out the bacteria that's getting stuck in there. A healthy immune system should be able to fight off the viruses and bacteria, but it can't do that if it's too clogged up and can't get access to the bacteria. So flushing it out, in fact, does make sense. So for an acute sinus infection, short-term use, it makes sense, although there's nothing special about the neti pot. You can use a saline nasal spray, for example, and that will be just as effective. Routine preventive use, not helpful, and may, in fact, be a bad idea. Now, there is a homeopathic treatment for the common cold called oxylococcinum. Now, I'm going to give a complete lecture on homeopathic remedies in detail, so I'm not going to go into background about homeopathy itself. But I will say that oxylococcinum has been studied as a specific homeopathic treatment for the common cold, and it has shown no benefit whatsoever. So regardless of the theory, the evidence is negative. Interestingly, oxylococcinum itself is made from duck liver and has a fairly interesting, if dubious, theory behind it. It was based upon the mistaken microscopic studies identifying what was thought to be an oscillating bacteria. But it turns out that that itself was just an illusion. There was no oscillating bacteria there. It was just an optical illusion of the microscope itself. So therefore, it doesn't really even exist, the oxylococcinum itself that's supposed to be in the homeopathic remedies. Let's talk a bit about preventing the common cold. Obviously, the best way to treat a cold is just never to get it in the first place. And that means frequent hand washing. You don't have to use any special antibiotic soap or anything. You just need to wash your hands just with plain soap and water, and that will clear the viruses or bacteria off your skin before you have a chance to infect yourself with it. You should also avoid exposure to people known to be sick, especially in the first 3 days of their illness, when they have a fever and when they're shedding. That's the time when they will be shedding the most amount of virus. And also avoid, when you are sick or when you are around other people who are sick, avoid touching your eyes and your nose. That is the most common route of infection. You also may decide to just avoid crowds when you yourself are sick. That way you'll do everyone a favor by not spreading the virus around. Perhaps you shouldn't feel obligated to go into work when you're shedding virus with a cold. They might appreciate that. When you do have to sneeze or to cough, sneeze into your elbow or disposable tissue and avoid personal contact. Especially wash your hands frequently when you yourself are sick, so you will avoid spreading the virus around onto other objects, which then become fomites or something that will then transfer the virus onto other people. Clean counters and other surfaces that are frequented by people, especially if you have kids in the house or if there are sick people around. Kids' toys are often covered with viruses, and therefore keep cleaning them and keeping them sanitary will help when there are sick family members around. Dry air can also dry out the nasal mucosa, making it more vulnerable to viruses. So using a humidifier, if the air in your environment or in your home is too dry, may actually reduce your risk of getting a cold, in addition to making you more comfortable. And incidentally, this may be yet another reason why getting the cold is more common in the winter. In the winter, when it's cold and you're using heat to heat the air in your home, that often will dry out the air in your home, drying out your mucous membranes, reducing your resistance to infection. So use a humidifier if you have dry air in your home. In addition to dry air and low humidity, other risk factors include smoking, which may increase the duration of a cold by an average of 3 days, a history of smoking. Yet another reason why you shouldn't smoke, as if you need me to tell you that. Sleep deprivation generally runs down the body and makes you more susceptible to infections, including the cold. And interestingly, recent evidence suggests that vitamin D may be helpful in preventing the cold, which is a bit ironic in that there has been so much obsession with vitamin C. And it turns out that vitamin C doesn't prevent the common cold, but perhaps another vitamin, vitamin D, may. At this point, we have just preliminary research, and more research is needed. But if your vitamin D levels are low, it certainly makes sense to supplement them. What are the symptoms of a common cold? Well, most of the symptoms of the cold are actually not caused by the virus itself. It's caused by your immune system fighting off the infection. The immune system is what causes the inflammation. There are inflammatory compounds that are released by your immune system, like histamine and prostaglandins and kinins and interleukins. These cause the blood vessels to expand, which is what causes the congestion. It causes the mucosa, the membranes, to swell up, which also contributes to congestion. It also irritates the mucosa, activating the sneeze and the cough reflexes. All of those things are caused by your immune system itself. Which actually brings up an interesting question then. Should we really go out of our way to treat those symptoms? Should we treat the symptoms of a cold? Or by doing so, are you just suppressing your immune system's attempt to fight it off? Well, it turns out that the immune system is probably overreacting a little bit when it's fighting off a cold and causing more symptoms than are strictly necessary in order to fight off the cold. So if you reasonably treat your symptoms, your body can still fight off the infection without any problem at all. So don't worry about treating those symptoms. If you have a fever and it's making you uncomfortable, treat it. You don't have to be coughing and sneezing to get rid of the virus. And you certainly don't need swollen membranes and congestion in order to fight off an infection. 25%, in fact, of upper respiratory viral infections are asymptomatic. So in other words, you can get a cold, you can get an upper respiratory infection, and a quarter of the time, your immune system will fight it off without causing any symptoms whatsoever. What about a fever? I mentioned fever as one of the symptoms of a cold, and there actually has been a little bit of a controversy over what is the optimal way to treat a fever with a cold. It is part of the body's immune response to the virus. But do you need the fever to fight the cold? Well, the answer to that is no. You can fight off the cold fine, even if you completely mask the fever with antipyretics, the name that we give to medications which reduce fever. Actually, another little mini myth here is that normal body temperature is 98.6 degrees. This is actually a very arbitrary figure. It was just what someone measured as the body temperature at one point in time. But subsequent evidence and research shows that there's actually quite a broad range of what is normal body temperature. And medical science at this point in time doesn't consider someone as having a fever unless their temperature goes greater than 100 degrees Fahrenheit. Do fevers cause brain damage? Do we need to worry about fevers because they're going to heat up and damage the brain? Actually, the answer to that is mostly no. The kind of fevers that you are very likely to encounter, even what we would consider a high fever, up to 104 and 105, the kind of fever that would make a parent somewhat nervous, is not going to cause brain damage. Only extremely high body temperatures, like 107 to 108, which is not going to result from a common cold, can actually be at risk of causing brain damage. What about the old adage of feeding a cold and starving a fever? That was sort of based on the notion that, well, temperature comes from food, therefore if you take food, that's going to create more body heat and force the fever. But it turns out that that simply isn't true. Your body is regulating its temperature neurologically, hormonally, aside from the food that you eat. So short-term, feeding a cold or starving a fever has no health benefit, and that really is just an old wives' tale. Also, what about taking an ice bath? Some people still feel that if you have a high fever, and you can make somebody feel comfortable by giving them an ice bath to quickly cool them down. But that is not recommended. It's actually not healthy to chill the body to that degree, and it's absolutely not necessary in treating a normal fever that would occur with a cold. So no ice baths. Are there any over-the-counter medications you should keep on hand to treat you or your family members when you get a cold? Well, certainly you can have acetaminophen or what are called non-steroidal anti-inflammatory drugs, or we call them NSAIDs for short. That's aspirin, ibuprofen, or naproxen would be the generic names for common NSAIDs that you can get over the counter. And one of the effects they have is an antipyretic effect. It will treat the fever. So that will absolutely make people feel more comfortable. And again, you shouldn't worry about doing that. It also is an analgesic. That means it's a painkiller. So if you're having any sinus pain or just generally feeling uncomfortable, or if your throat is sore and raw, the acetaminophen or NSAIDs will help reduce some of that pain. But as I said, a lot of the pain and a lot of the discomfort and symptoms of a cold are caused by inflammation. Now, acetaminophen is not an anti-inflammatory. So if you have a lot of inflammatory symptoms, that's not going to be the optimal over-the-counter medication to take. You should take an NSAID. You should take an aspirin or ibuprofen or naproxen. Although I'll point out, do not give aspirin to young children, as that has been linked with a rare but serious side effect called Reye's syndrome. But for adults and for children, you can take non-aspirin NSAIDs like ibuprofen. They are the best single thing to have on hand for treating most of the symptoms of a common cold and making you feel much more comfortable. What about cough suppressants? Coughs can be a very annoying thing to have to suffer through with a bad cold, especially if you get a bronchitis. Interestingly, a lot of common products will mix together a cough suppressant with an expectorant. And that makes no sense when you think about it. You shouldn't be trying to get up your phlegm with an expectorant, but then suppress the cough that's going to get rid of it at the same time. So generally, we don't recommend taking products that have a lot of different effects mixed together. If you are having a somewhat productive cough and you want to get the phlegm up, then take an expectorant. If your cough is dry and annoying, then you would want to take a pure cough suppressant. However, the over-the-counter cough suppressants are really not very effective in suppressing a cough. And recent studies in children essentially were unable to document any benefit to cough suppressants in children. So they're of very limited utility. You can also adjust your behaviors in order to reduce the symptoms of a cold. Drinking a lot of fluids is very helpful. It will help prevent dehydration. It will help prevent drying out the mucous membranes. But you don't need to overdo it. You don't need to force fluids. Just don't let yourself get dehydrated. If you can eat, that will make you feel better as well. You don't want to go hungry during an illness or during a cold. Rest if necessary, but you don't need to force rest. You just don't want to be sleep deprived. Another reason to treat the symptoms of a cold is so that you can feel more comfortable and get a good night's rest, which is important to fighting off the infection. But undergo normal activity. Perhaps nothing strenuous if you're really feeling under the weather, but there's no reason to stay in bed or to be bedridden. And avoid smoking or exposure to smoke, as that can irritate and dry the membranes and does extend the duration of symptoms in a cold. What about chicken soup? Is it really beneficial to drink chicken soup during a cold? Well, any hot liquid will help moisten the mucous membranes, will reduce the sore throat, will help hydration like any liquid, and may also loosen up the mucus in your sinuses and help expel them. But there's nothing special about chicken soup itself. There is some evidence that there may be some anti-inflammatories in vegetables and hot soup, but you can also get that and at a much more optimal effect and dose just by taking an aspirin-like drug. I'd also like to distinguish between the cold and the flu. Now, they have similar symptoms. The flu, however, is much, much more severe. It's of longer duration. It can last up to several weeks, whereas a cold usually is less than a week in duration. And specifically, a flu is caused by influenza viruses. So you have to have an influenza virus in order to have the flu. Prevention and treatment is essentially the same for the common cold, with the exception that the flu has vaccines that will prevent specifically influenza viruses. There are seasonal flu vaccines, and occasionally for flu epidemics, if we can get to them quick enough, we might be able to make a vaccine specific to a flu epidemic. But for most people, getting a seasonal flu vaccine is a good idea to reduce your risk of developing the flu, which, as I said, is a really, really bad cold. So in conclusion, there are many myths surrounding the common cold. I think I've put most, if not all of them, to bed with this talk. Everyone at some point is likely to need this information, either for yourself or for a loved one, or just avoiding getting the cold around the office or out in public. It is best to be armed with accurate information. There are a lot of things that you can do to reduce your risks and reduce your symptoms. And it's also nice to know that with correct information, you can Avoid wasting your time and resources doing things that are not helpful, and maybe even avoiding a few things which might make the situation worse.